I am so proud and honored to welcome you, our Magnet Recognition Program appraisers, to NCH. During your visit, you will find a culture which aligns and integrates nursing across the NCH continuum. At NCH, our vision is to become the premier destination for nursing practice in the northwest suburbs of Chicago. Nursing here is a partnership with the healthcare team, patients, and the community we serve to transform healthcare. Through our partnership, we achieve both nursing and organizational outcomes and are a true reflection of what a Magnet organization exemplifies. As CNO, I hope you see how we work to be a premier and preferred destination for nursing practice through transformational leadership, structural empowerment, exemplary professional practice, and new knowledge, innovation, and improvement.
At NCH, transformational leadership focuses on values, beliefs, and behaviors which support the fluidity of healthcare. Transformational leaders are visible, accessible, visionary, and strategic partners who use input to influence organizational change. Our leaders can come from every level and every department, and it is their advocacy and approach that leads to effective change. The overall benefits of transformational leaders are inclusive change and an objective focus on improvement. Such improvements can impact the organization, the employee engagement, and patient outcomes. The productivity is also improved from a perspective of input, which directs the change planning, process, and implementation. Engaged employees are productive employees because they are able to see the impact of their advocacy and influence with the outcomes.
Two of our transformational leadership examples this year are from our emergency department, where we saw a decreased length of stay for ruptured AAA patients, getting them to where they needed to be quickly for immediate intervention. Patient length of stay was reduced by 11% with the streamlined process to transfer a AAA patient from the ED to our operating room. Our transfer time went from 78 minutes to 69.75. Another example of transformational leadership is the implementation of our emergency department pharmacist program. Our dedicated pharmacists support our physicians and nurses to take improved care of our patients. It's so wonderful to see the collaboration between our physicians and nurses who look to our pharmacists to determine the best and optimal treatment for our patients when it comes to antibiotics, pain medication. They work side by side with us on all of our critical cases, our codes, our strokes, our cardiac alerts. It's made such a difference. And really, we're not two separate entities. We're one team working together to provide the best care for our community.
Structural empowerment is the building of a foundation using innovative and creative approaches, which provides the structure to empower staff to develop and sustain professional practice reflective of the mission, vision, and values of both the organization and nursing. Structure can take many forms, however. The common goal is to achieve outcomes that are of the highest quality and support the community that we serve. Structural empowerment is the framework which identifies, develops, supports, and sustains professional practice. Professional practice is evident in the ability for our nurses to bring recommendations for programs and software applications which result in better patient outcomes.
Implementing the structural empowerment framework gives the nurses a powerful tool that helps them succeed in their field and allows them to always demonstrate best practices and quality outcomes. NCH is always adapting and adopting programs which improve practice and patient experience. NCH sustains a culture of structural empowerment through shared governance, access to evidence-based practice and research, and promotes an environment of recognition, continuing education, and specialty certification. An example of this is the software program adopted and integrated in our triage call center. It was integrated into the education plan, which correlated to the expansion of our triage call center in order to support and facilitate all of our NCH medical group physicians. Nursing telephone triage has become increasingly important as a way to improve the healthcare process and overall patient satisfaction. Triage nurses adapt their knowledge and skills through interaction with patients as they cannot depend on sight or touch to support assessment. The use of clear triage enhances efficiency to streamline medical care for the patient so the nurse provides accurate direction ending in an appropriate patient disposition.
Exemplary professional practice is a focus on the role of the nurse at every level and in every setting, and it is the cornerstone of excellence, collaboration, quality of care, and best practices that work together to realize remarkable results. Nursing practice is exemplified through nurses providing care to patients and families, being part of an interdisciplinary decision-making team, and applying evidence-based practice. One of our magnet stories this year focuses on SNAP huddle rounds and length of stay. During this quick huddle, the hospitalist, clinical care coordinator, and nurses meet together with each other to discuss each patient's status, to include current length of stay and barriers to care progression and discharge. If identified barriers cannot be resolved at the huddle, the issue escalates to NCH leadership.
New knowledge, innovation, and improvement demonstrate the inclusion of creative approaches and the use of evidence to contribute to the science of nursing. It promotes the use and inclusion of evidence-based practice, research, creative solutions, and technology into nursing practice. It is these tools which support efficient and effective work environments. The focus is on the discovery of new ideas and solutions through the process of investigation, completion, and sharing of processes, products, and approaches. And it leads to consistent improvements and quality outcomes that are driven to improve patient experience, working environments, and organizational goals.
The sharing of information allows us to reflect on current practices, gain insights and awareness as to what works for others, and identify an innovative way to problem solve. Healthcare is ever-changing and evolving. Nurses involved in research, planning, and workspace redesign promote environments which foster growth, and the growth equates to personal and professional achievement and outcomes. This year, we wrote on the nurses' involvement in the redesign of our inpatient rehabilitation unit. Our nurses were involved and provided feedback and design ideas such as the proximity and location of bathrooms and workstations in order to support patients and their safe recovery. In addition, the design ideas support nurses' safety and work environment.
We also wrote about the John M. Bowler Center for Rehabilitation grant. Eileen Gillespie, our CNO, led the team in regard to the allocation of funds. Grant money went to therapy equipment, scholarship funds, and cutting-edge technology for rehabilitation, which helps lead to exceptional outcomes for our patients.
Thank you for your time, and I truly hope you sense the magnetic force between NCH and Magnet. We are stronger together. Welcome.